Hi, everybody. Welcome to the May 13th Board of Health meeting, and this is a coronavirus meeting. So the town of Littleton began conducting remote participation / Zoom meetings pursuant to Governor Baker's emergency order suspending certain provisions of the open meeting law on March 19, 2020. Since that time, unanticipated legal concerns relating to the open meeting law have been brought to our attention by the town clerk. Those concerns were supported by the Attorney General's office and confirmed by town council. One concern is that the chat function allows a parallel text conversation to a board's public meeting. Chat is essentially running commentary that is occurring, but it is not moderated or followed by the chair. All participants and listeners may not be aware of comments being made because some meeting participants join by phone and do not see these conversations. Another concern is conversations between residents within the chat room, which are not incorporated into public record. In response to these concerns, the town will implement the following changes, which in no way prohibit any member of the public from participating in discussion and sharing information during a public meeting, and will ensure that all listeners and participants have equal access to this meeting. People that join the Zoom meeting are set so their microphones are muted. If you called in by phone, please use *6 to mute or unmute your phone so that the meeting can occur in an orderly fashion. We ask that people who join keep their microphones on mute so background noises do not interfere with the meeting. If you wish to participate in the meeting, please use the raise your hand function available on Zoom, or if you called in by phone, dial *9, which will activate the raise your hand function. The meeting host will notify the chairperson of the raised hands, and the chairperson will determine whether and when to allow public comment. When called upon, participants should unmute and then state their name and address. After speaking, we request the participant return their microphone back to mute. Okay, here we go. Scott, how about if you give us an update on your week so far?
Sure. Actually off today, so enjoying the sun.
Nice.
So what Jim, myself, and Ed Mullen, the building inspector, went through all of town hall last week. I think it was Tuesday morning, and just evaluated all of the spaces that could potentially have interaction with the public. And so we looked at the counter space and evaluated what we may put up, being, like some type of plexiglass similar to what you've seen at the grocery stores or the hardware stores, something like that, so that there would at least be a plexiglass barrier in between, every desk and where somebody from the public may come in, and also kind of looked at the areas and discussed different signage. Just to really limit the amount of people in each location, and put markings like that in the hallways, keeping everybody kind of that 6 to 8 feet apart. So I know that is going to the Board of Selectmen on Monday night. So next Monday night they'll talk about that, and then hopefully the supplies will be ordered to put that stuff in place. For that time when town hall does reopen.
Okay. Is that anybody have questions for Scott?
What did you say, Scott? That was just for town hall to reopen?
Yeah, that's where we went through and looked at. We
Okay.
checked out all of the spaces in town hall, the school department, Elder and Human Services. I'm sorry, what was that?
I thought I heard you just say in town, not town hall. So that's why I was just wondering where you.
Oh, yep. Town hall. I think the only place that we didn't think about was maybe the transfer station. Had a discussion with them yesterday, possibly about like their trailer that they're in. maybe even putting some plexiglass inside there so that when they open the window, they could potentially open up their operations and just, keep basically a small space at the bottom of the window for money exchange.
Okay. Any other questions for Scott? Gino?
I'm mute. Okay. I just wanted to know, Scott, anybody else that got sick in Littleton from the police department to the fire department?
Not in fire
No.
or police. There are
Thank you.
a variety of residents that, the list continues to go up and down. People go on the list, people come off the list, but
Thank you.
not in fire or police.
I'm happy for that. Thank you. Be safe, okay?
Thank you.
I'll wear the mask every day. God bless.
Very good.
Thank you for what you're doing.
Thank you.
Thank you.
Yep, thank you very much, Scott. Can we have an update from Jim Garepi now?
Sure. Thanks, Louise. So I just want to kind of touch on some of the things that are new this week, at least for us through DPH. Obviously, at the end of or the middle of last week, the mask order went into effect throughout the Commonwealth. Myself and Louise went to a number of the establishments in town on Friday to check and see how it was working, offer them some educational material, actually get to stand and see the actual operations and see who was or wasn't, and provide them with signage if they needed that. So I don't know, we probably went into about a dozen places Friday afternoon. And I would say most all of them were in pretty good shape and weren't reporting a whole lot of problems. The occasional customer, but not a whole lot of problems. We did have one place that they were having a hard time being aware of the fact that we're asking about the mask order with our masks on, and they weren't getting it. I'm happy to say that upon visiting today, they are fully aware of the mask order now and seem to be taking care to make sure they're wearing the mask. So of the places we visited, everybody seems to be on board. I will continue visiting the balance of the locations in town just to, again, check, see how they're doing, offer any kind of educational support on that and signage if they want it. We talked a little bit about the reopening of the town hall. I'm sure you've all heard about the governor's reopening plan. Again, a very high level plan. I don't want to say vague, but he's laying down, I think, the foundational components of the plan. And then I think what we hear on Monday will kind of fit within those things that he's laying out. I think I sent the notice out to Louise. I don't know if it got to all the boards about the 4-phased approach and then the mandatory safety standards for the workplace. I think those are the main components that with whatever we're doing and whatever opening plan the governor has, those 4 safety components will be part of any of his plans. So again, it's at a higher level now. I was on a public health call today. They weren't giving us any more specifics. And I was listening to the governor's conference this afternoon. Again, he's really waiting to roll the whole plan out before he even takes questions on what might or might not be happening on Monday. Some of the places we're talking to, I seem to think that on Monday they'll be open to do business. And I've mentioned to them that I don't really think so. I think on Monday we're going to find out what group of businesses will be able to open and with what controls. So that's kind of the reopening information. The contact tracing collaborative, we had a conversation with the supervisor for the Neshoba towns, kind of explained what we were looking for, what some of our specific concerns were. We think we're at a pretty good place. We've got a name and a face, someone to call to. So we're going to start using the collaborative. So people in town, in addition to getting public health nurse messages, may get a call from the CTC. I want to work up some kind of a note that maybe can go on Facebook pages and town websites that lets people know that it may be the public health nurse or a contact tracing collaborator, a contact tracer from the CTC that may be calling them, and please answer that call. DPH recommendations, I think it was on Friday. We got recommendations from the state epidemiologist that people who are contacts of positive cases, they recommend that they get testing done. So that's kind of a departure. It's not that they're mandatory, but they're recommending that whether they're symptomatic or not, that contacts to a positive case get testing. And they're still kind of working out some kind of a notification process that the board can give those individuals to go to their primary care to say, hey, look, I'm a contact to a positive case. The Board of Health recommended that I get testing. So we're kind of waiting for a template or some more guidance on what that letter might mean for us and how we might present it to the public. Talking a little bit more about testing, we're seeing more antibody testing happening. And I'm not sure exactly why, but DPH, there's a little bit of problem with the antibody testing in that it tells you that you were exposed to the virus, but doesn't necessarily tell you where in that timeline of infectiousness you were involved. So the state's taking a very conservative approach to this antibody testing. So if we get a report back from the state that you had antibody testing and tested positive, if you have no other information, so you didn't have a positive PCR, the state is looking at that as a positive case of COVID, and then we'll handle it as we would any other positive case, with the recommendation that if you've had the positive antibody test, that it would be good to go get a PCR, just so we would have some additional information to know whether you're currently infected with it or that it was a historical infection that you had. So again, it's creating a little bit of, I wouldn't say issue, but just not even misunderstanding. It's just some additional layer of information that people try to sort through with testing. The antibody testing is, again, letting you know that you were exposed, just not when. Because we don't have any other information, we're treating it as if you are until you prove otherwise. And I think that's all I have for the updates. I don't know if anyone has any questions.
I have a question for you, Jim. There was an email from Cindy Napoli questioning the breakdown of the numbers in town. Did you see that?
I did. By distribution of age, it will take a little bit of work to go through each one of those cases and open it up and see what the age of the person was. We don't, and it's probably in there, but it's not something that it openly reports to the state. So again, I haven't had a chance to go through all the cases to kind of sort through that. Except that there's a group at the nursing home, and then there's a bunch in town. There doesn't seem to be any other grouping in town, if you will, of cases. Occasionally, you'll get 2 cases at a house, and typically it's spouses maybe, or a parent and child, or so. Sometimes if we see a couple, it's typically at the same address, and it's typically family related because they're contacts, if you will.
Any other questions for Jim?
You do have one person in the attendees after the board.
Okay. I'm just going to wait on the attendees' questions for a minute. Before that, I would like to, Mike had a point that he wanted to discuss about as people go back to work. Mike, do you want to present that and let Jim give you an answer? No.
Mute here successfully. Am I being heard? I just want to make sure. Can you hear me, Louise? No.
We keep hitting unmute at the same time. Sorry about that.
Okay. No problem. All right. There we go. Thanks a lot. All right. Whoops, back again.
Mike, before you start, Cindy Napoli had a question for Jim. So let's just let Cindy ask her question, please. Go ahead, Cindy.
Hi, Louise. Thank you. So, Jim, I just wanted to clarify on my email question to you regarding the breakdown of positive cases in Littleton by age group. I was curious if you had that information readily available. If you don't have it, it's not necessarily something that I want you to spend the time putting together specifically just for me personally to respond to my question. I just was curious if that level of tracing had been is being conducted in the town.
So to answer your question, it's on, in most cases, the age is on the lab report or the information that comes through Maven. We haven't been pulling it out of the reports and aggregating it any other way. We're just taking the addresses to give to the police and fire, and then making sure we get the case numbers to the town.
Okay, great. Thank you very much.
You're welcome.
Okay, Mike, sorry for that. You want to continue?
Yes, I'd like to pick up on a theme perhaps that Jim sort of glanced into, but I want to focus more on the, shall we say, the process and the progress that the governor and his colleagues and his advisors have pursued. And one thing shows up is, from my point of view, very glaringly, is that Massachusetts, like many other states, completely are deficient, seriously deficient in ability to test, whether it's the PCR or reliable serological tests. And the reason this becomes important is, if you look back and make a long story short, one of the reasons we are where we are today with all the uncertainty and continuing hotspots around the country, we have the potential in Massachusetts, if we're not careful, to have something quite similar. That is, that we open up and find out within about 2 or 3 weeks, maybe less, that we're back again into a firestorm. And has nothing to do with opening up early or late. It has to do with the fact that we have no idea to this date, because of lack of testing, the actual spread of the virus. And what I'm including here are not just the people who show symptoms, but also the people who are asymptomatic. And the tests for the asymptomatics are not yet refined enough, at least the ones that are being deployed in the United States and provided to the states, or the states are able to purchase. And this comes through clearly in some of the statements made by our state officials, who are reluctant to proceed with anything resembling a strategic and well thought out testing program, which is vital. Otherwise, we're going to be right back where we started from, maybe worse. And discussing opening is sort of, to me, has a certain element of fantasy with it, even though I'd like to see them open. I'm sure everyone else would. But just consider it, then I'll move on to the other reason I'm bringing all this up, is that just consider what it would be like in order to really open, or to even open gradually. Most folks have children, and the question is, how comfortable should they be, will they be, in having their kids go back to school? Because without the kids going back to school, what do we do about childcare? Whether, and I'm talking about K through 12, as whether, and also colleges. So if you want to take sort of a graphic of this, the fact that we can't discuss school, that we can't really go at this, suggests, again, the lack of tracing, the lack of adequate supply of testing materials. And this is not on Jim, it's not on anyone. It's a national, serious national issue. And one of the reasons, what I would like to do is try to help push the governor as much as possible to seek those resources, because he's in a tough spot. Don't need to go into politics with it for you. You probably know exactly what his situation is. It's rather noteworthy when certain folks mention governors are doing very, very well. Very rarely does Baker get mentioned. Other governors who are doing as well, as, if, you know, how do you compare apples to oranges? And the other, obviously, is the fact his relationship with the federal government, which is not on him. But that's the situation we're in. So what I was proposing, and like our group to briefly consider, is basically a program that actually accomplishes something in testing other than the static testing we're doing now, where everybody more or less stays in place. And that is to engage with I picked 2 organizations that seem to have on the surface, and a little phone call reveals they do have the capacity, and begin asking the question, what happens, what kind of questions should be asked and answered in order to facilitate commuting? Because most of the folks who live on the 495 corridor, and we're included in that, either alongside or right in it, do not work in their resident homes. They basically leave the house, work someplace else, wherever it is. Whether the radius is 10 miles, 25 miles, north, south, east, or west, it doesn't make any difference. So the real question is, and it works the other way as well. Littleton has an example of that. The IBM facility, pretty close to 98% of their employees do not live in Littleton. So for them, migrating here on an opening probably has a certain, shall we say, epidemiological feature to it that someone who lives in Littleton, say, going to Marlborough or going to Nashua, has a totally different profile. So we need some questions about what is the prevalence, what is the real spread, how many ASIMs are there out there, what does that do to change our behavior, in addition to social distancing, in addition to wearing masks. So the two organizations that I thought could ask the real important questions, not necessarily the ones that I propose, I'm not an authority on this area by any stretch of the imagination, is the Mass Association of Board of Health in Massachusetts. It's just so a pure coincidence that the current president, happens to also be a very, very well-regarded and very expert person in biostatistics at the Chan School at Harvard University, which is one of the leading epidemiological survey organizations in the country. And the other organization is the 495 Enterprise Group, which basically is a sort of a loose conglomeration among businesses and governments on the 495 stretch. The idea here would be for those two organizations or something like that to provide both the stimulus and, to the extent that they can, the funding for asking the key questions about what I'll call migration or commuting. And without the testing that goes along with it, and this is where I think that the Baker administration might appreciate the push from below, is here are the kind of questions, here are the kind of serious questions we would like to have answered or addressed so that citizens themselves can understand what's going on and assess the risks themselves, along with what the state advises. I think so far as I can make out, although I think people are giving feedback to the Baker administration, I think the thrust of the two organizations I mentioned are typical of those that might just get the attention needed to address the relevant question about the spread of the disease and the impact of commuting. So what I'm proposing here is for those who may be interested to either think about it, we can come back and discuss it at our next meeting, or reject it out of hand because we want to wait and see what the governor does or someone at the federal level does. The mere fact that the CDC is being impeded in releasing their expert guidance nationally and the fact that the onus of securing materials for the state, by the state, rests on the state itself, are both signals that we're going to be, that unless we're far more aggressive, testing is going to be extremely difficult, and therefore having anything resembling control over the virus is going to remain elusive. Thank you for your patience.
Jim, can you speak to that at all, or?
So it certainly sounds, I'm certainly not the experts that Mike is looking for to come up with that information. I'd like to think that the governor is listening to the Department of Public Health to get some of that information. You can hear him talk about certain statistics that he's looking at as far as considerations he's making for opening the state back up. I'm not sure how many more statistics behind that there are that Department of Public Health providing for them. We can certainly ask Massachusetts Association of Health Boards if there is a set of information that the governor's looking at and that they're pushing to try to get down some of these other statistics that Mike talked about. With the contact tracing, I know that's one of the things the governor talks about when he's talking about being able to sustain and expand the opening of the state. I know I think the last count, they had 1,000 contact tracers. I'm not sure if they're still ramping up to hire more. And again, when we started this public health crisis, we weren't necessarily doing the social distancing and the mask wearing and that. So hopefully that helps us in some regard until we can get some of the answers to these questions. To your point about testing, Mike, one of it seems crazy that one of the pinch points for getting enough testing done is getting enough of these swabs to actually be able to swab people. That seems to be where we're falling short on getting enough of these things to actually get these tests done. I don't have an answer to that. I know everybody's scrambling to try to get more of those things to be able to do more testing on a more regular basis.
Jim, I was not expecting you to answer any of these. Please, this is not, this is what I'm really obviously after here is for us to seek a very different kind of expertise, not necessarily out of the usual mechanism of the state, but basically there is, to me at least, and other folks I've talked to in the field, there is no sign yet. And Baker's being, I think, extraordinarily cautious not to overpromise. We just don't have the testing ability nor the tracing capability to really actually claim at all that we know A, what's going on, and B, how to really address it. Everything is sort of like 1 foot forward, trial and error, and there's a limit to how much time before the next wave comes and where we are during that next wave, especially in Massachusetts.
I know for testing, it's interesting to look at the dashboard. On any given day, you can have anywhere from 7,000 tests being done a day to almost 15,000 being done. And I'm not sure if that's demand or the distribution of supplies or people's desire at any given day to get tested. So at a minimum, I know they can do 15,000 tests a day because you see that many. I know the governor was saying he'd like to get that up to 30,000 cases or tests a day so that we have a better picture on what's happening. But again, what I'm hearing is the swabs still seem to be that shortage.
Yeah, it's my understanding they have problems with the reagents. I mean, it's also the quality of the test. I mean, it's we're now into the weeds that I don't think there's anything anybody at this meeting can do anything about. And so what I'm really seeking action from us is whether or not we as a board want to enlist other boards through the association and through the 495 initiative, basically to have a larger group and a more expert, shall we say, face on seeking the resources and the, as it were, the approach to testing, but associated with something that has some significance, namely schools and community.
Does anybody else agree with Mike? And maybe we could come up with a letter that we could send to the MAHB or DPH in Littleton for the Littleton Board of Health. Kevin?
I 100% agree with Mike. You know, the testing is I think absolutely necessary as we begin to open things back up here. And to his point about all the folks that, like IBM, for instance, they're coming from out of town. Would it be reasonable to require, businesses that are going to be reopening to, at the least, take temperatures at the door, and if there's any other symptoms, kind of try and get them set up for a test. And furthermore, I was just scrolling through the testing facilities. I mean, it looks like Emerson is the closest. And I'm wondering that if we can coordinate with ORIG 3N testing to maybe get the urgent care center up at the top of the point to set up a tent outside as the weather gets better, and potentially have folks that, may have a temperature, be presenting symptoms, not have to travel too far, make it a little bit more convenient for them to just head over the highway and go up to the top of the point there. And maybe we can coordinate with the folks at Emerson to do that. On the website, there is a place to apply to get a bundle of those tests, and I'm just wondering if that might be appropriate, just to try and take some precautions and sort of try to figure out where we're at and who might have it, and try and get them quarantined and try and stop the spread as fast as we can.
Well, I think that Emerson at the point is already set up as a testing facility. Is that correct?
I didn't see them on the list, but because they're Emerson, maybe it's just a satellite and they are set up. I just don't know the answer.
Yeah, I thought Scott had mentioned that at one meeting, but we can check that out. Oh, so Kevin,
I think they're testing site for if you have symptoms.
If you have symptoms, right?
Judy?
Lowell General has a testing site, drive-through is available as well, but you do have to pre-register through your doctor.
Yeah, there's one in Chelmsford. I'm just looking over this PDF.
Yeah, I know in Lowell, there's a site that you can get your results in 30 minutes.
Yeah, that's awesome.
So Kevin and Mike, is that something you would like to work on together? Maybe craft a letter and we can review it at next meeting?
And try and speak to the MA
HB?
Association of Health. Yeah.
My only comment is I think that Kevin is trying to solve a problem, a somewhat different issue, which has to do with the logistics of the testing itself. And the thrust of my suggestion has more to do with what are we doing the testing for? And to apply what I would call encouragement and support of the state element of this. In other words, I'm trying to do something above the level of the board, an individual board of health. I'm trying to basically get someone who could sit at the table as a co-equal and make it clear just how urgent it is to secure the necessary testing materials. I don't think we can solve the logistic problem for Littleton. It's no meaning whatsoever for us to, gather as much information about Littleton. It's just statistically not significant. The commuting and school issues are the major ones, because the longer that people that the youth can't go back to school because their parents are hesitant or afraid or have good reason to be afraid, the harder it is to do anything beyond talk and very limited amount of quote opening, limited to basically those folks who walk around in a bubble most of the time. So, and that's not very practical. I'm also looking at other countries where they have successfully undertaken these kinds of well-crafted testing programs and contact, and how successful they've been, and what happens when they yield to pressure to back off the measures taken to maintain them. So I think it's important that we get to this sooner rather than later. So my interest would only be, or the only thing I could probably do myself would be to get in contact with the two organizations I mentioned, only as examples, and see if there's any level of interest in themselves doing it. But I'm certainly not trying to do this just, for me. If the our Board of Health is interested, at least I would be able to say the Board of Health of Littleton is interested in doing this, period. And asking the question from that. And if I'm not the right person to do it, that might also ask Jim, which puts him in a tough position, because I'm aware of the fact that suggesting such a thing might be looked at as a kind of criticism from the rank and file of the system. And I certainly don't want to put him in that position. It's a little easier if someone from the citizenry, as it were, does it, but that's just my view. So I hope it's clear. There's nothing here I think that's novel. I think it's been done before. It's just that it's a different setting.
I'm in agreement.
Go ahead, Kevin.
I think it's a great idea. I think someone we can write a letter. We can put it out there to folks, and maybe there's someone, if it's not the chair, someone else. If it's not Jim, we can find the right person, potentially with the right skill set and also set of contacts at the DPH and the state level to try and get the idea across. If we put together some sort of consortium of local boards of health, there's power in numbers, and I think that if we let the voice be heard, it's kind of hard to ignore it.
Is that something that Jim can help us with? Or does Jim have an opinion on that?
I have no problem, crafting or, want to give me some bullet points. I appreciate, Mike, your concern from my position with my fellow public health folks, but I don't have a problem expressing your opinion and doing it vigorously. So
would it be appropriate for us to get the contacts for all the chairs of all the local boards of health and maybe try and put this in front of them and run it up the flagpole, and especially within that 495 corridor that Mike was talking about?
It'd probably be a little bit of work to get all the board chairs, but yeah, that's not an issue.
Yeah.
We can just send the letter to the boards of health in those towns and just address it to the chair. So
Okay.
Excuse me, Littleton has an ongoing contact with the 495 group, and they're quite open. They're a phone call away.
Good.
And it's hard for me to believe that the president, I'm sure she's very, very busy, but Jim probably knows better than I do about the best way to contact her. And the nature of the communication with her might be very different than, for example, someone who is an administrator as opposed to a pure professional, which she is. Jim, do you happen to know her or know about her?
No, I'm not sure who you're talking about, Mike.
She's the current president of the Mass Association of Boards of Health, Massachusetts.
So we're on these public health calls, and the person that is most often on that call from that organization is Cheryl Sabara. She's their legal officer. She helps boards of health with legal questions. So I'm not sure the name you're speaking of, but I could certainly find that. That's not an issue.
Yeah, I mean, I can help you identify her. It was pretty quick, easy to. It's a question of who basically can engage her, given her schedule in a brief conversation and her level of interest in even getting involved in this.
I've spoken to Cheryl. I have her contact info.
Yeah, certainly Cheryl I have no problem getting in touch with, but I'm not sure that's the person you're talking about, Mike.
No, I'm not.
Okay. So again, if I was going to approach her, I guess I'd want to have a kind of a bulleted, that old notion of an elevator pitch.
Yep.
So that I could pitch that to her and then say, geez, once you've had a chance to kind of digest this, could you give us a call? We're interested in talking.
Did you get a general idea from my long-winded comment about what direction heading in, or is this do you need more amplification?
I do need more. So I guess I would want to sit and chat with you to kind of refine it just a bit more so I understood it if she had some questions for me.
Okay, fair enough. If it's okay with the board, I'll be happy to do that with Jim.
Yeah, thanks a lot, Mike, for doing that. And just come up with some bullet points. No politics involved, just the bullet points would be great, very helpful.
What politics?
Okay.
One other thing I just wanted to mention regarding the testing, I guess you can apply through Fallon Ambulance Service to set up a facility or schedule some testing. And it seems like on the contact form, they have the estimated number of patients to be tested and staff to be tested, different facility types. So I'm just wondering, does it make sense to try and set something up there as a, for folks that are interested or concerned to be able to access that and potentially set up in a location in town here, and maybe Scott has some thoughts on that too, since Fallon Ambulance probably works hand in hand with him.
Yeah. Well, Scott had to leave, so.
Oh yeah, it's his day off anyway.
He's not here anymore. So
I
we'll
can
have
follow
to
up
check.
with him if you want, Louise. And
great. That would be perfect, Jim. Thank you.
okay.
Anybody else have anything to add to this?
I have a question, and it may be a little premature after we hear what's going on in the phases that are starting when we start on Monday. But maybe you know this, Jim. Are there going to be screening? Are there going to be temperature? Will there be temperatures taken? Will there be screening questions done? I guess I don't know how they can do it for retail and restaurants and things like that as they start to open, or is this again just we're learning this as we go along kind of thing?
So again, I'm not sure. The examples I know, like Walmart, I think now has a screening process for all their employees. So they, at least in one of the stores that's in our district, you go through a side door. All the employees come through the side door. They go through questioning. They do a temperature check. They give you your mask for the day, so that because they require before the states changed, they required people to wear masks. again, to try to answer that question, they have those mandatory safety standards for workplaces. I think they're going to be working within those guidelines. I don't see anything specific to temperature taking in those things. I think probably the important thing is to make sure that all the hygiene things and the social social distancing things are in place. I'm sure companies are going to stick with their current policies because if they're working, I mean, nobody wants to see your store like a Walmart on the news. So if that process works for them, I'm sure it's worth them making sure that they continue doing that. Again, they have a lot of staff being able to, and again, what we're finding when we're doing some of the contact tracing for some of the people who showed up at businesses, sometimes temps come in, sometimes temps just need to work that day. And so it's hard to kind of enforce a company sick policy when you don't have one of those things. So those are the things that kind of the nitty gritty that may need to be addressed in some of these workplace situations so that business could have a really tight HR policy going forward to make sure that they're keeping people out who are sick.
And maybe, I guess, if we see through contact tracing that we see a spike coming from Littleton, or I guess Littleton, but they would we go in and talk about their hygiene and their protocol for how people are coming in?
So that's kind of how we found out about the temp situation, is that there were a couple of cases showed up in one of the businesses in town. Once we got we got calls from two separate other boards of health, because with those employees lived in other towns. So those boards of health called us and said, hey, look, we have a resident in our town who works in your town. We just want to know. And so I went down and spoke with the company. And they already were doing some of these same procedures, keeping people apart. This was before the mask wearing. And one of the hard things they were having is sometimes the temps come in a vehicle together. So they're not driving by themselves. They're all hopping in somebody else's car, or in some cases a van driving them to work. And so I tried to educate the person at that business about the need to really enforce, or reinforce, I should say, with their with their temp provider, that they maybe need to do a little bit more to make sure those temps are coming to work or coming to their workplace safe.
I read an interesting article yesterday, and they were talking about the percentage of infections and how it's not really coming from retail because they are following protocols and precautions, but that most of the positive cases now are coming from family contact and social contact. So I thought that was interesting. That means that, Market Basket, CVS, that they're doing their job, but individuals are not always.
And maybe that speaks to maybe when you're at home, you're not doing the social distancing and the mask wearing that you're doing when you're out in public. And if one person in the house tests positive, and you're not being that fastidious about isolating that person, which may be difficult depending on your house. Maybe that's because we've seen that when we get a second case at the same address, again, it's usually that family situation.
Okay, so Mike, you will come up with some bullet points for Jim to address, and Jim will call the Mass Associated Boards of Health. And Jim, are you also going to call the 495 Metro West, or?
I guess I'll get some more information. That's the first I heard of that organization. I'll talk to Mike about that.
Okay. All right, great. Thank you. Nina is on this meeting, and I was wondering if Nina could update us on the Board of Selectmen meeting last night about town meeting.
We actually didn't have a Board of Selectmen meeting yesterday evening. There was a Finance Committee meeting, and I understand that there was a considerable amount of discussion with regard to the annual town meeting and the considerations if we had an annual town meeting before June 30th or after June 30th. Is there something specific that members would like me to expand on? I do think that there will be additional information available over the course of the next, certainly 72 business hours, but as far as when and potentially where we would have town meeting, just to kind of line up a little bit of the scheduling and how that might work. If we are to hold a town meeting on June 15th, as currently planned at 7 p.m., the Board of Selectmen would need to finalize the town meeting warrant as well as the town meeting report at their meeting on Monday, May 18th. If that date were to be pushed out for any reason, then the board would have a little bit more, Board of Selectmen would have a little bit more time to finalize the report and warrant. And I guess that's the best high-level summary that I can give, and be glad to answer any questions.
Was Diane Corey was gonna, and Scott were gonna scope out the middle school for the 6 feet distance and whether it was possible to have it indoors or outdoors. Have they come to any conclusion yet? And I'm sorry if I'm jumping the gun.
Through the chair, no, I don't think you're jumping the gun. And admittedly, I haven't had an opportunity to connect with Diane Crory, but I do know that in our last conversation, she had scoped out the gymnasium, and she, and if I'm not mistaken, the Chief Scott Wazinski had gone through and done some measurements. And I'm trying to pull up an email that I have very quickly to see if I can provide some specific details along those lines.
You don't need, I mean, you can give us a rough idea of just if she's been looking at it. I know they have been. There seemed to be a little bit of concern on Facebook last week about whether or not we would have it indoors or outdoors. So.
Yeah. Sure. I mean, I think the best thing I could say at this point is that further discussion on that subject would happen at the Board of Selectmen's meeting on Monday night.
Great. Thank you.
That's really what I just wanted an update from when last week we had our meeting, and it was going to be talked about at the Board of Selectmen. So we'll wait to hear from that meeting. Thanks a lot, Nina.
Sure. Thank you.
Any other questions for Nina? Okay. Are there questions from the general board or on anything? Kevin?
I was wondering if it would be appropriate, or if the board members would agree that it might make sense to, as businesses open, take temperatures and see, just take account of who's coming, where they're coming from, taking their temperature, seeing if they have a cough, see if they're presenting any symptoms, just to try and be precautious, just to be cautious about it and proactive.
Well, I'll tell you, I'm going back to work next week, depending on what Charlie Baker says, and we are doing screening over the phone for our patients. We're taking temperatures when they come in. The staff is having their temperatures taken morning and afternoon. So I have to do it. So I think companies need, I mean, it's a lot of education. It's a lot of prep work. It's a responsibility. Somebody has to take it. I think that people should be taking precautions to protect themselves, their employees, their customers. I don't know, again, how we enforce it, but we can suggest it.
Well, perhaps we can, I don't know if there are point people at different businesses that would take the responsibility for getting this done, or if there's an outside service that would be able to accommodate such a thing as people start rolling back to work.
That would have to be on a daily thing.
Right. So just so I know, how is your, I mean, obviously you guys are, medically trained and everything. So you probably have someone on your team that's going to do it.
Yeah. And we're going to there's a chart, forget where it's from, but it's a chart with the staff members and their temperatures for where they came in the morning and when they left. And then obviously if anybody's sick, I think we still need to have the companies be vigilant and send their people that are sick home. Don't come in if you're sick. There should be somebody on staff that is responsible for taking temperatures. And if they're over 100.4, then people don't come in. But that has to be, the business owner's responsibility.
And do you think I think that sounds like it's going to be burdensome for a lot of business owners, especially, small businesses. Maybe you just have one person running the register and, and that's where they need to be because they can't be outside taking temperatures at the same time.
Well, I'm not saying temperatures for your customers. I mean, that would, I think, turn off a lot of business.
Yeah.
Why we're opening to start the businesses up, but the staff should definitely be screened before they go to work and come in contact with more customers too.
Do you think that it would be appropriate to see if we have any medically trained folks in town, doctors and nurses, who might be willing to volunteer for such a task that might take some of the burden off of business owners to do such?
Is Alex McCurdy still on? Maybe he has something with the Littleton Volunteer Corps.
I think there's two or three RNs that Alex has on his team there, and I know there are some other folks in town that will be willing to maybe talk about volunteering for such a thing.
Yeah, I'm here. I can answer any questions you have about that. We have not discussed that specifically, but that would probably want to be done by a clinician of some sort, and we have a few of those. But again, we'd have to have more specifics before I could determine what we were able to help you with.
Madam Chairman, may I make a comment?
Go ahead, Mike.
With all due respect to the effort to take temperature around town, I think that one should be a bit cautious here because the number of asymptomatic individuals in our population remains, except for gross numbers, unknown. And it's well known, on the other hand, that one of the greater sources of the spread of the disease is not just from people who are sick or showing the symptoms. Most of it's coming from ASIMs, those folks who have the virus infected but show no symptoms. In other words, their temperature is normal. They don't cough, or they cough but don't have a temperature, or they have a temperature and don't cough. So even if you had all 5 things in a row, you can still be technically asymptomatic. So I'm not sure that, again, in the absence of testing, that asking clinically trained people to line up and collect anecdotal information will serve a useful purpose. I'm much rather have them, if we had the resources online, basically collecting data that really informs about are you infected or not, and to what extent. And he just got, and there Kevin's example of an asymptomatic carrier.
He's got it. I know he's got it.
Yeah. Now the question is, now I'm teasing. I have no idea, which makes the point.
Maybe, I'm just thinking out loud, but perhaps if we had a list maybe of all the businesses that were going to be reopening in phase 1 that are in town, maybe someone could speak to the Fallon folks to maybe set a day to set up camp there and test people that if the temperatures aren't going to matter and if they're asymptomatic, in this drop down, and I can send out the link. I think it was in the email that Louise had forwarded. There's drop downs here for, estimated number of patients to be tested, number of staff to be tested, where's the location, requested testing date, et cetera. Y is at the end. Yeah, it is. Thank you. DLOCK. Maybe that's one way to do a little bit more due diligence on the asymptomatic folks that Mike's talking about.
I don't think we can go around. I don't think we can just, set up a testing site like that. That's been mentioned several times before, and it's not a possible thing. So we can refer them to.
Like at the businesses,
Yeah. It's hard to get testing materials now. How a business is going to be able to do it? They could send their employees before they come back to work to go get tested, maybe, but I don't know.
Just looking at that link.
this, I'm not sure, but it would be nice, and maybe not from us, but, you know, maybe a guideline from the state on how to open. I think they're gonna have that,
Yeah.
guideline on how to open and what you need to do to open. Like, we needed to get N95 masks in order to open. And that, we can't open unless we get those. So not everybody's gonna need that, but, you know, there may be some kind of guideline, protocol from the state, protocol from Board of Health on how to open safely. And then, you know, I guess if, again, I don't know, primary cares, and stay home if you're sick, go to your primary care and get tested. I don't know if we have enough testing to make a tent, or have, you know, a insurance company go to, or Fallon, whatever, go to each individual business that's opening up every day.
Yeah. It's a lot. I'm sure as the governor, you know, refines his reopening plan, we'll get more detail.
Yeah, I heard it was gonna be June 1st anyway.
Yeah.
What's June 1st? Reopening?
I heard they were gonna change the date. Yeah. It's all hearsay.
Okay, are there any?
Part of me says, you know, again, we're ready to go back because we're prepared. But really, it's not going to be that much difference in the next 2 weeks. We're not going to learn anything new. We're not going to have different PPE. It's going to be the same June 1st as it is May 15th. So, you know, but you just have to be educated. You have to, you know, understand what's going on. So, and be prepared for it. Because it's going to be a while before everything gets to be normal anyway.
Is anyone opposed to me reaching out, or someone reaching out to Fallon to see how we can potentially partner with them on something?
I don't see why it wouldn't hurt to utilize them, but don't make any deals before you talk.
I just want to get a contact. And
You know, it's a resource that we might be able to use, and who knows? So I wouldn't have a problem with it. We need to take a vote.
Okay, so a motion in a second. So let's take a roll call vote. Gino? Gino, you're muted. You're muted. Try again.
Okay. I'll try.
I got
Gino?
yeah,
Okay. What I'm saying is, I agree with whatever happened to, you know, I mean, everybody has an opinion. The question is, as long as everybody feel healthy and they wear a mask, they wash their hands. If it is sick, the best thing they can do is stay home. They can test everybody. The question is, are we able to do this? Are we going to have support from other Board of Health in the Commonwealth or the 495? If something can happen, I'm sure that a lot of people will be glad to volunteer too, to see if anybody, their fever is high. But if they're not
Okay,
sick,
Gino, we're actually voting on a motion right here, right now. So
I support. Yes for Gino.
yes. Okay, yes for Gino. Kevin?
Kevin Baker, yes.
Lisa?
Lisa Flanagan, yes.
Mike?
Mike Zeldin, no.
Louise Nichols, no. Okay, so it's 3-2. So Kevin, if you want to contact Fallon and
I'll just report back. I'll just report back to you.
okay, that's good. Get a contact and some information. Okay. Any other questions before we open it up to the public comments? Okay, Janet, is there anyone in the, anyone have a question that's online?
I don't see any hands raised.
Okay. Okay. Jim, do you have any last statements? You're all set?
I'm all set.
Okay. Okay, does someone want to make a motion to adjourn?
I make a motion to adjourn. Gino,
Is there a second?
Mike Zeldin, second.
Okay, so let's go do the roll call. Gino,
Gino, yes.
Kevin? Kevin,
I think he's
Frozen.
out.
is he frozen?
Flanagan.
I think he froze.
Okay, we'll come back to him. Lisa,
Lisa Flanagan, yes.
Mike,
Mike Zeldin, yes.
and Louise Nichols, yes. Kevin, one more time.